Well, workplace burnout is being taken seriously by the WHO, but what about companies across the globe? Well, let's bring in Marnie Dobson live from Los Angeles. She's an assistant professor at the Center for Occupational and Environmental Health at the University of California, Irvine. She's also co-director of the Healthy Work campaign. Welcome to the show.
Thanks for having me.
So give us an idea, what factors did the WHO look at when it decided to give this designation now?
Well, it's in some ways better late than never, because the concept of burnout has been researched and studied for over 30, 40 years now, at least since the 1970s. And it's a particularly costly disorder that affects people, throughout the world in many ways. So although they didn't classify it as a medical disorder, they did classify it as an occupational phenomenon and syndrome, which kind of leaves the door open for really addressing the prevention of burnout rather than sort of just focusing on some kind of medical treatment for it.
Now, you mentioned in terms of the classification, since it's not classified as a medical condition across the board, how do employees go about addressing this with their employers or even their health insurance companies?
Well, one of the things that I think we focus on as part of the Healthy Work campaign is thinking about the workplace and the factors that are maybe concerning people that may lead to stress, that may lead to burnout eventually, because burnout is ultimately a job-related disorder, and there are very well-known and well-researched factors in the workplace that contribute to burnout. These can be excessive workloads, they can be low job control and not having a say over your work tasks or schedule, low social support and at work from maybe supervisors, as well as like a toxic workplace where there may be bullying going on or other issues like workplace sexual harassment. These can all contribute to burnout.
So how does burnout mirror or differ from general depression, anxiety or stress?
It's a good question, and it's one that researchers have been grappling with for some time now. But in general, we know that depression tends to have multiple causes. It can come from childhood trauma, it can come from a family history of mental illness, and it has some things in common, like feelings of tiredness, feelings of a loss of self-worth or efficacy, and so forth. But where burnout is preventable if you address the work-related aspects, depression may be harder to treat, especially clinical depression. And at that point, medication may be the most important thing to do to be able to treat your depression. Whereas with burnout, it is reversible if you address workplace issues.
Now, with some conditions, if it's not something that manifests itself physically, you get a lot of people who say, who cares about burnout, or that it's a millennial or a first world issue. How do you respond to that?
Well, we do see disturbing trends in young people with burnout, people in their 20s and 30s. And, we've heard about this hustle culture and this kind of culture of overwork among, millennials. It's an ongoing problem, not necessarily of millennials, but of maybe the changing nature of work. We really do see an intensification of work. People are working longer hours. They're working harder. We're working less time for vacation. And, it's taking its toll. But it's not just a millennial problem. We know that it crosses all socio-demographics. For example, young, old people, it can affect professionals as well as people in low-wage sectors. We know, for example, that physicians have some of the highest rates of burnout. Their burnout rates have been skyrocketing for some time, upwards of 50% by some estimates of physician burnout.
So then, given the rates of burnout that we're seeing, what steps are corporate leaders taking, or should they be taking, to not just wipe out the stigma, but really just sort of keep up with the newer culture of work?
Well, I think there needs to be more done. I think we've seen sort of this blossoming of wellness programs since the 1990s that are focusing on employee health and well-being. And mental health screenings at work, for example, are really important. But you hit the nail on the head with the idea that stigma is an issue, because it does prevent people from participating in those kinds of programs if they feel their confidentiality might be in jeopardy and they don't want to admit this. But I think one thing's important to understand is that they're probably not alone, that if you have burnout, people are probably experiencing similar symptoms around you, because it is related to the kinds of work and the kinds of toxic work stresses, as we call them, that go on in workplaces where there's a high prevalence of burnout. So wellness programs can help. I mean, you can practice mindfulness and meditation, yoga, but unfortunately, if they're not available during the workday, you can only use them after work and you're ready to go home and take time and see your family, they may not be particularly effective. Although they can be helpful, I think the really important thing is to really begin to tackle the culture of work and the health of the workplace.
Marnie Dobson there, Assistant Professor at the Center for Occupational and Environmental Health at the University of California, Irvine, and co-director of the Healthy Work Campaign. Thanks so much.